Okay, for the Psoas major, this is a huge one for low back problems. So, Psoas major, this is one of the deeper forms of massage. So, it's the anterior surface of the transverse process and sides of the bodies and discs of the lumbar vertebrae. So, it's actually really deep. You have to actually go underneath the colon to actually locate this one. And the insertion is the lesser trochanter of the femur. So, it'll actually go down to this area. So the major actions is it flexes the thigh, so it brings it up, and laterally flexes hip. And unilaterally assists lateral flexion of the spine, so it helps out with the spine region too. So I'll show you how to locate that. So you always want to find the navel region, go out, make sure it's not on the rectus abdominis. Again, you can have them do a little crunch. So with this one, what you're basically going to do is actually push straight down right here. And if you ever feel a pulse, of course, move it a little bit, or if you feel any round lumps, make sure you don't push on that area either. So you're going to have them take a deep breath in, take a deep breath, okay, a deep breath out. And you just sink your hands a little bit when they breathe out. And then you can do this many times to locate this. Okay, breathe in, breathe out. And sometimes people actually use two hands to actually stabilize it a little bit easier. And one more time. And once you're deep enough, what you're actually going to do is you're going to kind of rotate, kind of go underneath the colon then. So you can actually lift up the knee a little bit in order to feel that muscle a little bit better. You can actually have them try to do a little sit-up to just make sure you can feel that. But again, this is one of the deepest techniques for massage, this psoas region. So there's many trigger points for this. In the psoas, it can actually go to the lower back, like the quadris laborum when we get to that muscle. And it can actually go up a little bit for the referral, and actually down into the inguinal area. So those are typical referrals for the psoas major. In the iliacus, a lot of people incorporate those two muscles together, so they call it the iliopsoas group. But iliacus by itself is the superior two-thirds of the iliac fossa in the iliac crest region, and the lesser trochanter of the femur. So it actually goes down to this region. So it's on the anterior part of the pubis. It also flexes the thigh, bilaterally flexes hip, unilaterally assists lateral flexion of the spine, and assists in abduction and lateral rotation of the hip.